All right, thank you very much. Pleased to be joined by the Red Sox Foundation Director of Communications, Tyler Petropulos, as well as the President and CEO of the Dimock Center, Dr. Charles Anderson, and Julie Kim as well, the Takeda U.S. Business Unit Head. So, Tyler, the Red Sox have all these health partnerships. What makes these partnerships so important?
Yeah, so the Red Sox Foundation, our mission obviously is focused on health, education, and recreation. And in the space of education and recreation, we're very fortunate to have the capacity and resources to run our own direct service programming. That said, in health, we do not. So our strategy there, the most effective strategy we've found is to partner with best-in-class partners, which is the Dimock Center. So we've been proud to be their core health partner for nearly 2 decades now, and really to lend our platform and our brand to amplify all that they're doing. They're incredible. They provide access to 20,000 individuals and families every year, providing them with access to high quality, low cost human services, health services, education. And we couldn't be more proud to lend the platform, the resources, the time, the people. Throughout the years, we've been grateful to provide them with everything from monetary support to marketing support, but also to community service projects and employee engagement opportunities. Our leadership in our front office have spent countless hours there volunteering, and so we're especially excited though and grateful this year to have Julie and her team from Takeda be partners with us. And so together we share a philosophy that if we can lend our platforms to someone who's doing something as incredible as the Dimock Center in the space of health and health equity, that's exactly what we should be doing.
And Tyler kind of touched on this, Dr. Anderson. 20 years of partnership. What are some of the biggest priorities right now for the Dimock Center?
Well, when you think about it, we're still working our way through this pandemic, aren't we? You know, it's very clear that there's so many people whose homes have been completely disrupted during this pandemic. So that trying to even prioritize some of the basic things around access and care, most of which aren't necessarily covered by what we're paid through the payers. Right? We think about all the things we need to do in terms of navigation and engaging people in their care once again. This pandemic has significantly impacted the community that we serve right there in Roxbury, and it's this type of support, it's this type of partnership that allows us to really try to bring people back into care. Give you one example, there's a group we're working with now, 26 individuals, 18 to 40. Out of those 26 individuals, 12 of them no longer have a source of primary care. But through this type of support, I've got somebody in community bringing them right into the campus and connecting them with the resources that are required to get them back on that road to wellness.
And for you, Julie, how does Takeda's philanthropic strategy get kind of enhanced with this partnership with the Red Sox and the Dimock Center?
Well, look, at Takeda, our purpose is to improve health for people and create a brighter future for the world. And that's what brings us to work every day. But in order to do that, you know, we have a global philanthropic strategy that's been in place for many years, but we didn't have one specific to the U.S. So last year we decided to put that in place, and we're doing so that we can partner with organizations like the Red Sox Foundation and the Dimock Center to make sure that we can amplify the work that they are doing. I mean, you just heard some of the great examples from Dr. Anderson, and we recognize that as a company, we won't have all of the answers. So we have to be humble enough to say, we don't know everything. Let's partner with people who are in the communities, who understand what the needs are, and lend our support so that we can work together to amplify the work, as Tyler was saying.
How special is it for you, Dr. Anderson, to have Takeda's and the Red Sox Foundation support?
Oh, it's incredibly special, right? It's also special to the community, because the community also sees this level of support, which tells people that A, we care, and B, helps provide a sense of hope. This is us working together to really benefit those who really, really need it, and that's always a special thing.
And as always, Red Sox Nation, how can they continue to help the efforts by the Red Sox Foundation?
Yeah, so there's 2 upcoming ways, one of which is the 8th annual Road to Wellness 5K at the Dimock Center coming up on Saturday, September 10th. And folks can go to roadtowellness5k.com. It's a free community event. Like Dr. Anderson was saying, they provide so many amazing opportunities to bring together our community, and this one in particular promotes wellness and physical well-being in all folks in our communities. So we're proud to team up with them for that one. And then in the meantime, though, this weekend, everyone knows we have our 50-50 raffle, which is critical to be able to fundraise all that we do and continue to provide funding for all that we do. And so this weekend, we are running a special 50-50 raffle, guaranteeing it at $50,000. meaning one lucky winner will go away with at least $25,000. So fans in Massachusetts who are over the age of 18 can enter now at redsox.com/5050, and that will end at the end of the sixth inning on Sunday.
All right, big money. Thank you guys so much for offering your perspective. We certainly appreciate it. Back over to you.